Mr. President.
The senior senator from New Hampshire.
Mr. President, I'm pleased to be able to join my colleague from Maryland to try and point out how this issue is being manipulated. Almost 2 years ago, Congress, this institution, voted to end discrimination against women by health insurance plans. We voted to make it easier for women to seek referrals to see the health specialists they need. And we voted to give women greater access to affordable, preventive health care services, including contraception. These are important, historic advances for women's health, and they should not fall victim to ideological policies. Over the last several weeks, we've seen women all across this country stand up in huge numbers to support women's health. That grassroots support will be needed again and again to stave off ideological attacks on women's health care. Over the past year, House Republicans have repeatedly attempted to both eliminate funding for Title X family planning and to defund Planned Parenthood. Thankfully, we've been able to block these attempts in the Senate. 97% of the reproductive health services provided by Planned Parenthood in New Hampshire and across the country are preventive care. And as we all know, preventive health care lowers health care costs and saves lives. We were reminded of the important role Planned Parenthood plays in preventive health when the Susan G. Komen Foundation decided to end its contracts with the provider. It's unfair to politicize women's health in the way we saw played out in the media last week. Women from across the country let their voices be heard. The 750,000 women who received breast cancer screenings at Planned Parenthood clinics with support from the Komen Foundation deserve better. They didn't ask to be thrown into the political fire. They merely sought detection and treatment against a life-threatening disease. I'm pleased that Komen reversed that decision. I also commend the President for standing up for women's health and reaffirming the recommendation of the Institute of Medicine to protect access to affordable birth control for all women. The decision requiring health plans to cover contraception with no copays or deductibles will improve the lives of millions of women and their families. Birth control pills can cost up to $600 a year. It can be a serious economic issue for some women. Studies have shown that it costs employers as much as 17% more to exclude contraceptive coverage in employee health plans than to provide such coverage. Birth control is also a fundamental health care issue. Doctors and public health experts agree that increased access to birth control prevents unintended pregnancies. It is directly linked to declines in maternal and infant mortality and a reduction in the risk of ovarian cancer. It is linked to overall good health outcomes. Permanent and temporary contraception is critical for family planning purposes, but many women, a full 14%, use birth control for medical and health reasons, including helping to reduce the risk of some cancers, treatment for endometriosis, serious infections, and cysts. Now, let's be clear. In talking about the health benefits of birth control, I'm not telling women that they must use it. The decision on whether or not to pursue contraception is an individual choice that each woman must make for herself with her family. No part of the Affordable Care Act or the President's ruling regarding insurance coverage forces any woman to use contraception. However, birth control will now be affordable and accessible for any woman who, in consultation with her doctor, decides that she needs or wants to use it. The policy represents one of the greatest advances for women's health in decades. Sadly, there's an aggressive and misleading campaign to to deny this benefit to women. A conscience clause exists that exempts religious institutions, like churches, from having to carry insurance that covers contraception. 335,000 churches and their employees in this country are exempt. Now, many have argued that that conscience clause should be expanded to include religiously affiliated hospitals and universities in the name of religious liberty. The millions of women who work in a Catholic hospital or university, from the overnight nurse to the classroom aide or cafeteria worker, who choose to use birth control should have the same access as their counterparts at other institutions. That is their decision. It is not their employers. There are religions that believe divorce is a sin. Should these institutions be exempt from our labor laws and be allowed to discriminate based on marital status? Of course not. And this is no different. A recent survey showed that 71% of American voters, including 77% of Catholic women voters, support the requirement to make birth control available to all. They understand that religious freedom means that all women, Catholic or non-Catholic, should have the opportunity to make their own decisions when it comes to birth control. I applaud the President for his decision and for putting women's health above politics. Now, we know that ideological attacks on women's health care will continue, but I thank my colleagues who are here today for speaking out against those who want to turn the clock back on women, who want to limit access and availability of women's health services. We are watching, and we are going to continue to be watching. Thank you very much, Mr. President. I yield the floor.